If you're unhappy with the position or shape of your breasts and you've been told you might need a breast lift or mastopexy, you may be wondering, am I actually a good candidate for this procedure? Today, I want to walk you through how to tell if a mastopexy alone is right for you. And one very important factor that often gets overlooked, having enough natural breast volume to achieve a beautiful result. I'm Dr. Dimitri Koumanis at Saratoga Springs Plastic Surgery, and mastopexy is one of the most rewarding procedures we perform, but only when it's done on the right patient. Understanding who benefits most helps prevent disappointment and ensures long-term satisfaction. What does a mastopexy actually do? A mastopexy or breast lift reshapes the breast by removing excess skin and repositioning the nipple higher on the chest. It improves shape and position, making the breasts look firmer, perkier, and more youthful. What it does not do is add volume. The ideal candidate is someone who has sagging breasts with adequate volume. You may be a good candidate for a mastopexy alone if your main concern is sagging, but you're generally happy with your breast size. These patients typically still have enough natural breast tissue to create a nice, full shape once the breast is lifted and tightened and shaped. So the clear takeaway is a successful mastopexy depends on having enough existing breast volume to reshape. So why does the volume matter so much in a breast lift? This is one of the most important points I wish every patient understood. If a woman has significant volume loss, especially in the upper breast, the lift alone can sometimes result in a breast that looks higher, more smaller, or flatter than expected. In other words, the breast may be in a better position but still lack fullness. This isn't a failure of surgery, it's a matter of anatomy. So what are the signs you may not be an ideal candidate for mastopexy alone? You may not be the best candidate for a lift if your breasts look deflated or empty on top. You've lost significant volume after pregnancy or weight loss. You want more fullness or cleavage than you currently have in these cases. Combining a mastopexy with implants often produces a much more satisfying and balanced result. So combining a lift with implants is sometimes the better choice. When a patient has both sagging and loss of volume, a lift alone corrects position but not fullness. Adding an implant restores volume while the lift reshapes and supports the breast. If volume is lacking, combining procedures may be the best path to a result you'll truly love. If you're considering a breast lift and want an honest, personalized recommendation, schedule a consultation with me, Dr. Dimitri Koumanis at Saratoga Springs Plastic Surgery. Call us at 518-583-4019 or go to saratogaspringsplasticsurgery.com. Thanks.